Stroke is a leading cause of death and the leading cause of disability.
With stroke care, every minute counts.
It's estimated that we lose about 2 million brain cells a minute.
I remember being really sleepy, and I remember one time kind of stumbling around.
You want to get treatment as fast as possible. Cleveland Clinic's mobile stroke treatment unit is an emergency room on wheels.
When an EMS squad gets dispatched for a potential stroke patient, we get dispatched at the same time. If it does turn out that the patient is experiencing stroke-like symptoms, care will be handed over to us.
This unit has all the tools available.
The unique part of our truck is having the CT scanner on board.
We can determine what type of stroke they are having, whether it be an ischemic stroke, which is when there is a clot blocking the blood flow to the brain, or a hemorrhagic stroke, which is when the artery ruptures.
Could you tell me where you are?
Our critical care nurse and paramedic will assess the patient, hook them up to our cardiac monitor, insert IVs, as well as draw the laboratory samples.
Then we will bring in a physician virtually to examine the patient.
Hey, Dr. Uchino. This is a 61-year-old female. Stood up, started feeling like a giving away of her right leg.
We can get into the vehicle via the telemedicine and see the patient and make their assessments.
Ma'am, how are you doing? Can you talk to us?
If there's any type of therapy to be administered, we will do it right there on scene.
The TPA is infusing.
We have good evidence now for the use of intravenous TPA, which is the clot buster medication, and we can use that medication up to 4.5 hours after the onset of a stroke.
We're actually seeing that we're saving 90 minutes of time by bringing everything to the patient.
This unit was first trialed in Germany in a couple of centers, but we're first in the United States to be rolling this type of program out. We were able to implement different aspects of what they had done, but also innovate and bring in new elements that would be useful in our healthcare system.
One of the unique things that kind of separates us from the German experience is that we have the ability not only to treat the ischemic stroke, but also to treat the hemorrhagic stroke as well. We are able to administer therapy right on scene much sooner than if they were to come into a hospital.
In the United States and around the world, people are looking at this type of model to see whether they can implement it in their own setting. It really does take an organization like Cleveland Clinic to bring together the resources and take the initiative to do this kind of project.
We're here because we want to provide this type of care out to the community that much faster.
I could be not talking to you at all. I could really be having crazy, those residual effects, or I could be not even alive. I thought that was it, that this was the day that I was going to lose my grandmother. She has a second chance at life thanks to the people on the stroke unit.
It's exciting to be able to actually see that you're making a difference in a patient's life.